I just think this is an unconscionable thing to do to the public, not least given the 28.9% pay rise. I should probably bring in Jim as well on operational planning, but I'd just say a couple of things. We can mitigate against the impact of strikes, and we will, but what we can't do is promise that there will be no consequence and no delay, no further suffering, because there are lots of people whose procedures are scheduled over that weekend period, and in the period subsequently where the NHS has to recover from the industrial action, who will see their operations and appointments delayed. I have a relative in that position. My family are currently dreading what I fear is an inevitable phone call saying that there is going to be a delay to this procedure, and I just think this is an unconscionable thing to do to the public, not least given the 28.9% pay rise. The other thing that I have found actually shockingly irresponsible about the BMA's position is their leaders seem to be telling their members not to inform their trusts or their employers if they're going out on strike. Now, I might not agree with the BMA's strike action, but I do accept they have a right to strike. I do accept they've followed the rules in order to go on strike. What I cannot fathom is how any doctor in good conscience would make it harder for managers to make sure we have safe staffing levels, would make it harder for other staff who are going to be turning up to work that day, not least the staff who have not had a higher percentage pay rise, many of whom are paid less than resident doctors. So I just think the sort of the BMA's approach to this from start to finish has been completely wrong. They started off a year ago with an incoming government that had an enormous amount of goodwill towards them, an enormous amount of sympathy for the arguments they were making, and worked quickly to resolve those strikes. And not just a deal to end those strikes, but the opening up of a partnership where we could work together to improve the NHS. And instead of working in partnership, they've chosen confrontation. It's not too late, even at this late stage, for us to get back on the path I wanted us to be on, of working together, of driving real improvements for resident doctors and for patients, but it is going to require a different mindset. The government's changed, the policy's changed, it's time for the BMA's tactics to change, and the idea that doctors would go on strike without informing their employer, not allowing planning for safe staffing, I think is unconscionable, and I would urge resident doctors who are taking part in strike action to do the right things. I'm sure many of them will. Jim?
I better just check with the chair, because I'm out of my lot of time, Jim.
No, you've got another 51, 52.
Bring Jim in then on that one.
So just to add to that, I lived through this as a trust chief exec, in the last few rounds of it. It's first of all, to reiterate what Secretary of State said, everybody respects the right to strike, but this is hugely disruptive, much more disruptive than we've been able to describe so far. I've worked with all the consultant colleagues at the end of a week when they've been working very, very long hours through the night to keep the service going. I've met with families who've had diagnostic processes cancelled 3 or 4 times because of strikes. And a lot of this narrow definition about what's technically necessary, I don't accept. It's not that straightforward, and we won't be accepting that kind of process this time. So really hope that this is avoidable. But we also can't allow this to play out in the way that it did last time, with a huge impact on people's lives, colleagues working in the service, a cancellation and a disruption of clinical pathways that is very hard to quantify the impact on. So I would just say, let's not just get too focused on the impact on the elective list. There's a whole range of other disruption that comes with this that we must avoid at all costs.
Thank you.
Thank you for that line of questioning. Can I move swiftly over to Greg, please?
Thank you very much, Madam Chairman, and good afternoon, Secretary of State. Unfortunately, I shall be continuing some of the line of the questioning. Can I characterise your view, therefore, on the strikes, that the strikes prior to the general election were reasonable, whereas the ones after the general election were unreasonable? Just a yes or no.
Well, I felt that the previous government was unreasonable by refusing to sit down and negotiate with the BMA for extended periods of time. Yes? I think the strikes before the general election were avoidable.
So what do you think has changed with the BMA to change them from a reasonable organisation to an unreasonable one? I suppose what I'm saying is, what have you done or not done?
Oh, I didn't say the BMA were entirely reasonable throughout the entire period.
Well, what have you done? What have you done?
Keeping with their history, but
what have you done or not done, Secretary of State, that has made them come to this point of view?
Well, look, as far as I'm concerned, we've done the right thing. We came in. The strikes have been ongoing for a considerable period of time, at great cost to the taxpayer and at great cost to patients. We recognise the arguments that they've been making about pay erosion and about the conditions that resident doctors were working in, and we recognise the pressure they were feeling as doctors at a particularly early stage in their careers. And so I was proud of the deal that we did last year, proud of the decision we took again this year to implement the recommendation of the pay review body. Taken together, that's a 28.9% pay increase. And I would have expected, not unreasonably, that the BMA and resident doctors would think, okay, we might not have got everything we asked for, but we've moved considerably in the right direction, and this is a government we can do business with, as other trade unions do. We are, in the Labour Party, we're used to dealing with trade unions. Our history is anchored in the trade union movement, and we don't always agree with trade unions, even those affiliated with the Labour Party. But we do understand the value of trade unionism and the importance of deals and bargaining. But I don't see a reasonable kind of trade union partner in the RDC section of the BMA at this time, and I hope
but isn't that part
change.
of the problem, Secretary of State? Isn't the problem that you gave them a massively inflation-busting pay rise, you asked no increase in productivity or efficiency from them, so essentially they've just come back for more? Do you accept no responsibility whatsoever for the position we're now in?
Well, firstly, I don't hold resident doctors responsible for the sort of productivity challenges we have in the NHS. I think actually there are many aspects of the way that they are treated at work which are fundamentally unproductive. So I don't regret the deal that we struck with resident doctors. I do regret that they are in danger of squandering the opportunity of partnership in favour of a more adversarial approach, which is unnecessary, and I fear will prove self-defeating, because if these strikes go ahead, with the financial costs that are entailed, not to mention the misery inflicted on patients, we have to find that money from somewhere, and that will come at the expense of things that they value. I
think you've made that point clearly, Secretary, and I think I suggest we all agree with that point of view. In December 2023, you noted that the then government was giving a higher pay rise to doctors than it was to nurses, and you said it was, and I quote, completely wrong, a slap in the face to nurses, and it seems to me fundamentally unfair. So if the nurses went on strike, would they be being reasonable or unreasonable?
Well, I hope that we're not going to get to that position with nurses, not least because we do have a reasonable dialogue and relationship with the Royal College of Nursing, Unison, and others in the agenda for change.
I hope we don't get there
workforce.
either, but if we do get there, Secretary of State, would they be being reasonable or unreasonable, given your own previous comments on this issue?
Well, we're working with those unions on agenda for change, pay structure reform. That's what we've agreed to do. I think so long as we fulfil our end of the bargain, then everyone will be happy and we can move forward building on that progress. If this government breaks its commitment to nurses and agenda for change staff, I think they would be rightly and justifiably angry, which is why we're not going to do that.
So, given that, as we heard in front of this committee some months ago from the then CFO of NHS England, most of the amount of money that's been put in this last budget was eaten up by pay rises, inflation, drug costs, etc., and therefore there isn't a vast amount of money left. Will you commit to having no above inflation increases to any health staff during this Parliament?
Well, we firstly have an independent pay review body process. I think that process is working largely well. I recognise that trade unions have a number of criticism about the way the process works, and I'm always happy to talk to them about how the process could be better. I thought, for example, the criticism that the PRBs reported far too late in the year was not just frustration felt by unions, but felt by Me Too, which is why
I suppose what I'm trying to get to,
submitted
Secretary,
evidence
is
earlier.
what your view on this is. I mean, I understand the processes, but what's your view? Do you think the public sector NHS staff should get an above inflation increase over the next few years or not?
Well, we always take into account the recommendations of the pay review body. What I would say to NHS staff is the best way for us to be able to deal with the pay erosion they've suffered over many years, and to make sure that we have a competitive rate of pay for NHS staff and a decent standard of living for all of our staff, is to make sure that on reform and productivity we're going as hard and as fast as we can. And that's why we've had to make some decisions on things like the abolition of NHS England, and bringing ICBs and systems back to balance, which at the moment are causing considerable pain for people involved in that decision-making process, and anxiety.
I don't need to cut
but
you
that's
off,
why we have to
Secretary,
make some of those
a
choices.
small amount of time. I want to ask you about one other subject.